Electronics on the number one reggae and dancehall station in all of Africa. Hey, no. Take your time. Just go. Panda KQ. Lakini wingi ndani. Mama's story to make a time. It's 8 minutes past 8 a.m. You're hanging out to the Morning Vibes people, Kwambox Mbunde. And you can tweet at us using hashtag VibesMVP. Now, as I promised, we've got the CEO of KMA, that's Kenya Medical Association, in studio with us, Elizabeth Gitau, Minor. Good morning.
Good morning.
How are you doing?
I'm good.
You look very cheerful today, and it's a very dull day out
That's
there.
always me.
Yeah?
Yeah.
Okay, cool. You're totally a morning vibes person from now on.
Oh, awesome.
Yeah. What are people saying online, Brian?
Jamii bado nashtuka yeye ndio CEO mazi. I'm in denial. Ndani ametuma mtu mwingine. Shout out to Kaden Kiprop anasema ako locked kama kifuli kwa mlango. DJ Pickney anasema thank you Mr. President representing county 014. Papa Kimatu hadi ametype in caps lock. Ukienda hosi unaambiwa hutibiwi bila pesa, ati watu wametambua pesa hata kuliko maisha wenzio bana. Babylon paper everywhere, corruption is in every office. Fire them and judgment day is coming soon. Moses Odhiambo anasema great things than this kutoka Vibes kutoka Vibes Radio. Then Mike Shahira anasema hello, cancer should be declared a disaster. Most arid areas are prone to snake bites. Where can you get venom to treat snake bites? Many die on way to hospital.
What?
Yeah. And
snake bites.
Imagine. And where are the drugs in hospital? So many stray dogs everywhere. This increases the chance of rabies. Dear Mr. President, order on stray dogs to be killed and make treatment of rabies to be cheap.
All right, I'm going to go to Twitter. Silas is like, at my area, hospitals are really trying. But the problem is that you have to wake up at 5 a.m. And at 10 a.m. is when you get to see the doctor. What? What the hell is that, though?
Imagine.
Elseo Mwavula anasema no medicine, no worker, no response from government. Mwananchi anateseka kana kwamba serikali ni ya mpito. Who else is coming through? I mean, this particular issue for healthcare is really emotive. Why? Because everyone is affected. Yeah. It doesn't matter where you are. And that's why we really like the idea of universal health coverage. So, Dr. Liz. Can I call you Liz?
Yeah.
Liz.
Eliza.
No. I'm just going to leave it at Liz. Nikulize. Mm-hmm. What can Kenyans do? You're here. You've been listening to the previous hour. Where are we? What's going on? Why does it look like doctors love money more than treating patients?
It's because I would say our healthcare system our healthcare system is actually broken. Because it is underfunded. So you shouldn't have to pay for health services when you're sick. You should have prepaid for the health services when you're well.
Yeah.
So either through your taxes, such that the government funds the healthcare system, or number two, through a social health insurance or any other private insurance that should be there. So the essence of universal health coverage is for people to access quality health services without suffering any financial issues.
Yeah, because you know what we say here in Kenya. I'm telling you, like I even said it in the last hour. If, like, God forbid, someone in my family gets like a major disease, me kusema tu kweli natumia pay bill.
Yeah,
now to pay bill,
and it has become the
norm.
Yeah.
But then when I see those pay bill numbers, not in a bad way, I understand that person is probably in dire needs.
Yeah.
Because I mean, for the fact that you're working hard, you're doing your thing, you're earning your money, you're paying your NHIF, you're paying your taxes, and then someone gets sick, and now you literally have to put your pride aside and start begging, for lack of a better term. So we like the idea of universal health coverage, and we wanted to bring you into studio to help Kenyans understand what the importance of universal health coverage, what it would look like.
So all of us are consumers of the health system, straight from preventive health, so that you don't get sick, and even when you get sick, so that you get care. So universal health coverage is ensuring everyone, no matter who you are, whether you're poor, whether you're rich, it doesn't matter where you live, that if today you get a cold, you can go to hospital, not stay at home because you don't have that 100 bob to go to hospital. Yeah. Or if you get cancer today, there shouldn't be people who are able to go to India or to go to Europe to get care. Yeah. Yet you here in the country, you're being told in KNH you have to wait six months or more for your radiotherapy session. So for me, universal... Yeah. They actually have, sometimes you actually write those things, and unfortunately for the people who work in KNH, sometimes if you give someone 6 months, you even call the family after a few months and they tell you that person you're calling for actually died.
Wow.
So it's a very, very dire situation. So in terms of universal health coverage, what we need is better funding.
Okay.
Because when you look at the government allocation to healthcare, we've never even gotten to 10% of the budget. Yet health is one of the big things. Government looks at health as a consumer, yet health is something that can drive economic growth.
Yeah.
So it's an investment.
Yeah.
So if you have your people who are well, if you have your people who who are healthy, it means that you're actually able to drive development. So it starts all the way from whether it's a communicable disease like HIV or whatever, or when it comes to the non-communicable diseases. So our current system is actually not able to support all of us. That is why you see private health facilities coming up.
Yeah.
And in Kenya,
everywhere.
Everywhere. And they'll offer substandard care, some of them.
Yeah.
Because even when it comes to regulation of the health industry, is not very well regulated. If I say I'm a doctor today, how do you know I'm a doctor?
Yeah.
You don't know. So if I wear a white coat and I start treating you because you need the help, you actually go there. In a good setup, you should be able to access your health center, your public health center near your home.
Yeah.
I used to live in Embakasi, and there was Embakasi Health Center, and I used to pass there every day. But I never went in because, for me, possibly, you need a health system you can trust.
Yeah.
Kenyans do not trust the public health system.
You just had the guys from all across the country just saying, yo, it's my last option.
Yeah. And partly is because, as I said, underfunding, the service delivery that is being there, even the healthcare workforce that is there.
Yeah.
So either you have very few doctors in, or you have very few nurses, and even those ones who are there are overworked. So it means that they're not able to perform to the best of their ability. You also need essential medicines. So if you go to a pharmacy, which is not giving, you're always being asked to give money or go buy at some pharmacy outside. That is not quality health. Because
But that's because, well, Cicely Karaoke will say, we've dispersed the medicine. And then you hear that the hospitals, the clinics are not paying for the medicine from KEMSA.
So, devolution was a good and a bad thing.
Okay.
So, devolution, of course, the intention was to bring the services closer to the people.
Yeah.
However, it creates a big challenge, especially when it comes to even funding of the health system, because the hospitals might collect money in terms of what people pay, in terms of fee-for-service, or through NHIF, but this money goes into a county system.
Yeah.
So the county gets to decide what to
do the money.
Oh
my God.
So sometimes you find money which is supposed to go into healthcare is actually being taken to build roads, because possibly that is what will give political mileage. Because Kenyans have not gotten to a point where we demand that I must have medicines in a certain facility. So there are counties which are doing well, and there are counties which are
which counties?
So we're going to take a break from that. We're going to take a break from this conversation and just find out what people are saying. So just to recap what you've said, there are hospitals. They collect money from your services. So when you go to the hospital, you give an NHIF, they collect. Then they put it in county funding. Then the county then says, imetoka huku. They collect all, including parking fees, nini. And then they decide how to spend it. Well, it could be like political favors. Maybe someone wants to look like they're doing work. But I want to ask you, Kenyans who are listening in right now. We're going to put out a poll on Twitter and on Facebook. If your politician or your governor dealt adequately with healthcare in your region and didn't deal with all the other things, would you vote for that politician to go back to office? Is healthcare that important to you? Tweet at us. We want to hear from you.
Vybez Radio, we rule the nation in this generation.
104.5 Vybez Radio. The good vibes, the only station, is the station that you're tuned in to. Good morning, good morning, good morning.
It's so crazy out there. Hashtag fire this SCSs. Is the number one trend in the country.
What's not happening out there?
What's not happening? We're talking health.
Yes.
Do you know how many things are not happening?
Yes, healthcare is where?
In a shambolic state.
Kwanza saizi venye baridi iko. Kuna mtu amekaa kwa matri na mtu kando yako amekataa kufungua dirisha. Sasa mmekachiana, mmenuniana kwa sababu mtu amekataa kufungua dirisha na hivyo tu akianza kohoa, pap, umepata homa. Imagine.
You know the things like in this country, Doc. Elizabeth Gitau. Liz is in studio with us, and she's the CEO of Kenya Medical Association. And of course, we're talking about universal health coverage. You know, one of the things I fear, like I have real fear. Mtu anikohoe. I mean, because like in public,
yes.
when I see someone cough, like even if it's the driver or who with their mouth open, I get so livid. Because, dude, I've done research. Flus used to wipe out half the population of the earth.
Yeah.
And I was reading about superbugs and, you know, the next phase of a bacteria that could wipe out a big chunk of the earth. Airborne. Do you know the kind of damage it can do in this day and age? With transport, someone flying, you know, I was reading about SARS and them, and I was like, you know, go power to mahoma. But that's the least of my concerns. Nikigetia homa niende hosi. Will I be treated? Are there facilities? Do I have to fly to India? So we're talking about KEMSA and how they're distributing medicine, and you know, the CS is saying that look, the medicine is going out there. But what is the challenge? Which is what you were talking to us about.
The challenge when it comes to essential medicines, number one, I think, of course, I'd appreciate that the government is actually making efforts to ensure that we have developed an essential medicine list that actually speaks to what the facilities need. Because before you'd find an essential medicine list, which is very brief, it means that it's not helpful to the health workers to be able to treat the people. In terms of KEMSA, the biggest issue has been in terms of logistics and even how previously changing our culture where KEMSA used to distribute drugs based on what they have before. But now counties are actually now ordering for what they need. So KEMSA still has a few hitches here and there in terms of delivering what is needed at the various counties and efficiently and on time. Because they can deliver, but if they don't deliver on time, it does not help that patient. Because a patient, let's say like something like family planning, sometimes they go there 3-4 months, they are asking for their family planning pills, they're not there. By this time, this lady is pregnant, so it has not helped anybody. Or if you have a cold today, or if you have an infection that you need an antibiotic, it means that you cannot wait for KEMSA to deliver. So it means in terms of efficiency of getting these medicines to all facilities, it has to be there, and even more so focusing on the lower facilities, the level 2 facilities, which is a health center. In an ideal situation, in a working system, your health centers should actually cater for most of your needs. Because most of us have very minor ailments. So that we ease the pressure on the bigger hospitals to actually treat people who are actually critical. Or we should be having KNH as possibly a center of excellence for something, not treating every person or deciding to have a private wing where they treat colds and all.
What's up with that though? The private wing, are we down with that? Because I saw doctors were against it.
For us, as the association representing the doctors, we want a tax-funded health system. We want your government to pay for your health services. So we do not understand why KNH needs a private wing to make money off Kenyans, so that to say that now they'll give back the money to the public sector. We have this notion that public sector is for poor people. Public sector is not for poor people.
It's for every Kenyan.
Public sector is for everybody, and the only way it will change is even our politicians. Can they be forced to access care? Those covers, they have very super covers. They have covers worth even outpatient of more than 10 million. What is that? Imagine. Our politicians have the best covers. That's why when you're telling them you cannot access care in your facility,
like, what you talking about?
Like, why are Kenyans broke?
You didn't go that
Spoken
side.
like a true president.
No, it's true. So they are not in touch with reality. If today we had a law where they go to a public facilities, by tomorrow your public facilities would have everything that you need.
But then you also hear, like for example, the former president Moi, former president Kibaki, wanakwangapa within Nairobi Hospital, So the potential of us doing really good medicine and access to healthcare for everyone is there. It's just that the system has a lot of holes.
Yeah.
The system is great, but it has a lot of holes. Because I saw Cicely Karaoke trying to explain to people why there's no medicine in the hospitals, and you've just explained it like in...
She shouldn't have to explain, because by the time you're explaining, it means your system is broken.
Yeah.
Okay.
I just want my medicine.
Yeah.
I really don't want your
As to
explanation
rule.
as to... Because it's very easy. I think our health system is just very easy to set up.
Yeah.
It only requires the funding and the commitment. And I'm looking forward to a day where health would actually become a political agenda. That we actually judge people based on, am I able to access services in my facility? Yeah.
I like that you said that again. As we take this break, I'm just going to ask the question I asked. If your political leader was to improve access to healthcare in your area, as in, hakuna kitu hiyo funding yote yenye ana collect ya for the county government, anasema yote, or a big chunk of it goes into healthcare, and every single person in your county can access healthcare proper, ile yani hata unaingia tu hosi, mtu akulizi do, anakuliza kunauma hapi, kaa hapa tukutreat, would you then say, I might just give this person another chance? There's a poll on Twitter, #VybezMVP, or get onto Facebook. Let us know.
Nobody can stop reggae.
It's 104.5 Vibes Radio, 19 minutes to 9 a.m. Remember the next hour on my grind. Yeah, we talk matters to do with your career, to do with if you're a young person, you're thinking, oh my God, how do I choose the career of my life? All that's coming up in the next hour. Shout out to everybody who's going to work right now. Our MVPs. In fact, there's someone who asked me a question here on Twitter. Are you ready for the question?
I'm ready.
Let me look for it.
I hope I need troll. Because jana ule msaliniambia niache viatu parking. Ngoja tu. Nimekumaka. Wanted.
Someone was asking me about MVP. What does MVP mean? He says, I'm going to find that tweet. I'll read it in the beginning of the next hour. But what are people saying on Facebook?
Shout out to Kimani. Anasema ako tuned, ako locked. There's a guy called James Kimani. Okay, James Mbugwa. Anasema healthcare is nothing. Hakuna kitu yote inafanyika side yao. And a guy called... Peter Kimondo anasema healthcare is non-existent in his county. Yeah. So many guys actually complain wanasema
non-existent.
Yes, non-existent. Wanasema huko by the time umeenda hosi. Yeah, it's very tricky for you to be sorted.
Yeah. So we are aware that there's some companies that some counties, there's county level and then there's national level. Because you look at the universal health coverage, which counties did it start with? Which is the pilot?
Kisumu. There's Kisumu, there's Isiolo, there's Nyeri, and lastly Machakos.
Because you go to a place like Turkana. Today I was looking at the newspaper. These guys are still doing cattle rustling.
Yes.
Unafikiri wao wanafikiria juu ya healthcare? Kuna maclinics huko Turkana.
So healthcare has to go to even that person in Turkana. Exactly. They actually deserve. If you're talking about equitable health, that person in Turkana, whether they are rustling or whether they are moving from one place to another, whether you're a nomad, your government should find a way of getting healthcare to you. Yeah. If some of the NGOs have been able even to use camels to deliver care, your own government, they have a chief. Somewhere in Turkana. Yeah. Safaricom gets to Turkana. Yeah. So why wouldn't my medicine get to Turkana?
Good question.
You know, Kwambox, I remember when they were actually announcing the 4 counties that will be piloted for this test. Nilikach kwanza nikisema, mbona wana trust wase wa hizi makaunti, how come wanzi na sisi Nairobi since we are the most number of people? But they actually had a reason. A county like Isiolo has kidogo people. So akasema nyinyi ndio mnakaa mkishughulikiwa sana. We will know how to expand this to other regions. Then a county like Kisumu, the main reason why they are part of this UHC pilot test is because they experience the craziest type of diseases from vitu kama malaria, TB, HIV, ile inasumbua wase. Cancer too is, cancer is quite predominant in that area. So they said, since nyinyi ndio mnaaffectiwa sana na hizi diseases, let's focus on you guys. We see if we can expand it. There are a couple of women. There's actually a woman who was interviewed on one of the stations, and alisema she first gave birth to the first kid. Hakulipa kitu yote, alisotiwa. Now sasa alikuwa anaenda the second kid, and everything is free for them. So I think this is something that needs to be expanded to more people. But the budget, why? 4 counties, 32 billion.
Okay, this is a national budget.
Yes.
So, but then they're governors and they're counties. There's there's a lot of collection happening in your county. Are you taking part in telling your governor, by the way, apana, hii nini clinic yenye kwa hapa karibu na kwetu inafaa x-ray. Kuna pregnant women wengi wanakuja. You heard of that story of that guy who told us this mama had to be on a bicycle.
And you're pregnant.
Labor pains on a bicycle. Guys, I've never given birth, but that sounds painful.
Yeah, it is. And that is the reality on the ground.
Yeah.
I remember when I used to work in Moranga, there are women who are... Moranga is one of the very, very best hospitals in Kenya. So women would be afraid when they get to their due date. They'd be afraid to go back home because they're not sure whether they can reach the hospital in case they need to urgently, because they probably live in some hill somewhere and when it rains, for sure they're not coming to hospital. So health, there are many contributors to the health system, which even include now in terms of infrastructure. Do we have good roads? There, where we had floods, I think in the coastal region.
Everywhere.
Yeah, so you're having floods there. It means there are people who want to go to hospital. They cannot access hospital because they've been cut off by floods. So everyone has to play their part in terms of getting the health system in place. But there are small gains that we can use right now as Kenyans. Number one is NHIF. NHIF.
He's against it.
Against it, kabisa.
The reason I would say possibly you might be against it because you have some access to care.
It's actually based on experience, because by the time I think I got the card juicy. I applied for it, but I got the card last week.
It takes a long time.
It takes a long time. It took me 10 years to actually get back the card, because in my head I was like, I never use it plus from past experience.
Currently NHIF has come a long way from where they were.
Yes.
Because previously they were just used to reimbursing here and here. But now we're demanding more from NHIF. NHIF has actually improved now to even go. Usually they were in the public system. Now they've gone into the private system. They used to be inpatient only. Now they're outpatient. But for every Kenyan, before even like when you have a harambe, I always ask people, do you have NHIF? Because you cannot believe how much NHIF can. They might not be the best in terms of they might not cover everything, but they will come in at the time where you need. Let's say today you have like kidney failure. NHIF will pay for your dialysis. Most insurance companies would start asking you, oh, is that a pre-existing condition? Is it, but NHIF has come through for so many people. I think the NHIF should be more out there telling people what the changes they have done. And only 25% of Kenyans are covered.
And it's like literally, it's what, 1,500 bob to join?
I think it's 500 bob per month, which is about 6,000 a year, and that is for now the informal sector, which is a majority of us. And then now in the formal sector, now it depends on your income grade. That's when you. So in terms of that's another conversation in terms of health financing, in terms of even equity of how much people are paying. Because this person paying 500 and they earn maybe 10,000 versus someone paying 1,700 and they earn $1 million. Equity there. So that's another conversation we can have. But as it is now, our small gains that we might have is for people just to enroll. It's very cheap, 500 versus you being asked for 200,000.
True. All right, so we've really beat out this story for healthcare and especially universal healthcare. So it is attainable. We have the cash in this country.
It's possible
to be able to give everyone universal health coverage.
Because UHC, you start with even the essential, like the government will define what is the essential basic package that everybody needs. Possibly if you need a boob job, we are like, nah. But you see,
why did you look at me when you said that?
Did I have boobs?
Wow. That's why he needs a boob job.
I'm sorry, Brian.
It's okay.
Okay. So if they just define an essential package which says that if you have like hypertension, if you have a cold, we'll take care of you. But if you need anything extra, you might need to pay for yourself.
Okay. I really love this conversation, and I feel like this is one of those that we'll have to keep breaking down, because like that story for boob jobs. I want to know how many Kenyans are getting plastic surgery. It's a whole other story. Thank you so much. I promised that you'd be out before 9 a.m.
Okay, thank you.
And here you are. Remember, that's CEO of Kenya Medical Association, Elizabeth Gitau Minor.
Yeah.
Salimia Minor. And Have a great day. Thank you so much for all the information that you shared with us, and we look forward to having more great conversations.
Okay, awesome.
For the rest of you who are listening, it's time to go back to them reggae. Nice it, Natural Black. Let's go.
Vybez Radio, we rule the nation in this generation.